Okay, this video is called Female Fertility Surprise, and this is just related to observations I've had. I see a lot of women getting pelvis ultrasounds in their 30s, having lots of fibroids. Kind of all of a sudden, relatively big fibroids in their early to mid 30s. And so where this comes from is, if you look at the Bantu women in South Africa, they'd routinely have 9 or 10 children. Victorian age women, routinely 9 or 10 children. That's pretty common. Other hunter-gatherer populations, similar numbers. Often in these sort of societies, a lady's pregnant as soon as she has her first period, by the end of that year, and then nurses for 2 to 4 years and has a baby as soon as she's done nursing each time. So what I'm trying to say is that's been common for a long time. But nowadays, women tend to, many of them, use their 20s for getting education and training in whatever their job specialty is. And many of them plan on having their babies in their 30s. Neil Bernard had said that a BMI of 19 is a sweet spot for fertility. But if a person is eating a lousy diet, it can be difficult to stay skinny after 30 years of age. Also, the high schools sort of promote promiscuity with these health classes that are really about learning how to, put condoms on bananas. Okay, and then sexually transmitted diseases are very common. Sometimes these can lead to HPV and even surgery of the cervix and whatnot, which can impair fertility potentially. They can scar off the fallopian tubes, increase the risks of having ectopic pregnancies. I've seen several women who, really wanted kids, but they had scarred off fallopian tubes. A lot of women also have some thyroid problems, increase the risk that the baby will be born with mental retardation. That can be from Hashimoto's, from eating goitrogenic foods, possibly, perhaps from soy. Women are exposed to a lot of estrogenic chemicals that they're not aware of, from dairy, from non-organic herbicides. That'll include things like atrazine, which is on all the corn quite often, the GMO corn. Soy itself is very estrogenic, cosmetic preservatives. There's a lot of estrogen-type chemicals in soaps and laundry detergents, dishwater detergents. And surprisingly, and this I think is one of the major issues, a lot of tap water is high in estrogenics and also in aluminum clarifiers, a metalloestrogen. So what I'm saying is there's all these converging risk factors. And she says, I'll wait till my 30s, but she should really plan it like maybe 5 years in advance at least to have everything ready, because what I see happening is these women, they come for an ultrasound in their 30s, boom, big fibroids all over the place, and it's really lowering their fertility, and it was sort of like an unexpected thing. So what I'm saying is this is, can create a lot of happiness in a woman's life. You ask a 50-year-old woman, she's happier about her kid than she is about her job, most of them. So what I'm saying is they need to be aware of it, because I have women, they ask me questions, they're infertile, what can they do? I start telling them about estrogenic chemicals, and they start out with this everything in moderation stuff, and I tell them, no, you don't have much time. You want to reduce all of your estrogen exposures as much as you can, all your goitrogenic exposures as much as you can. And they kind of work around, try to get through that, and by the time they start figuring out what to do, it takes them too long. They don't have any earlier familiarity with these estrogenics in the diet and cosmetics and whatnot. The wealthy ones, I see them going for in vitro fertilization, which may or may not work, but many of them, and then especially many of the poor ones, I see this happening to a lot of female doctors. They never have a child.